Most people think aviation health only matters if you're a pilot, a flight attendant, or someone who flies often. But here's the truth most people don't know. Aviation health quietly affects everyday people, even if you've never stepped inside an aircraft. Today, I want to show you the big picture, not in a scary way, not with medical jargon, but calmly, clearly, and simply. Because once you understand this, you'll start seeing airports, flights, and even the air around you differently. I'm an aviation medical screening officer, and this is Health Aviation. Let's begin. When an aircraft moves, it doesn't just carry people, it carries air, pressure, microbes, fuel fumes, noise, stress, and environmental changes. And those things don't stay inside the plane, they move outward into communities, workplace, homes, and bodies. So let's start with the air itself. Airports are some of the busiest breathing zones in modern cities. Jet engine release ultrafine particles that are so small you can't see them, but your lungs can feel them. These particles don't only affect pilots or ground crew, they drift into nearby neighborhoods, markets, schools, and roads. Over time, constant exposure can quietly worsen asthma, trigger chest tightness, cause headaches, and increase fatigue, especially in children, the elderly, and people with underlying conditions. Most people never connect these symptoms to aviation, but the connection is real. Now, let's talk about pressure. You may not be flying, but pressure changes still affect you through supply chains. Every day, medicines, food, blood samples, vaccines, and medical equipment are transported by air. You understand? So, inside aircrafts, pressure and oxygen levels are lower than on the ground. This can affect temperature sensitive drugs, biological samples, and even packaged foods. If aviation health standards are ignored, the quality of what eventually reaches hospitals, pharmacies, and homes can be compromised. So, aviation health protects what you consume, not just who flies. Now, let's look at disease movements. Air travel shrinks the world. An infection that starts in one country can reach another continent in less than a day. This is why aviation medical screening exists, not to delay travel, not to punish passengers, but to quietly protect communities from outbreaks. When screening fails, everyday people pay the price through sudden outbreaks, overwhelmed hospitals, and restricted movements. You may not be at the airport, but the airport is connected to you. So, now let's talk about the noise. Aircraft noise is not just an annoyance. Long-term exposure to aviation noise increases stress hormones in the body. It affects sleep quality, concentration, blood pressure, and even learning in children. People living near flight path often report chronic tiredness without knowing why. Their bodies are constantly in an alert mode. This is aviation health too. So let's move to contamination, a part of my daily work. Aircrafts, ships, and other conveyances move between countries. Without proper sanitation, they can carry insects, rodents, bacteria, and harmful substances. Fumigation and inspection are not cosmetic procedures, they are public health barriers. When done properly, you never notice them. When ignored, diseases spread silently into markets, homes, and food systems. So, aviation health is strongest when it is invisible. Now, let's Now, here's something most people never think about: mental health. Airports, long flights, shift work, jet lag, and high stress aviation environment affects workers deeply. And those workers go home to families, communities, and society. Burnout, fatigue, and stress don't stay at work. Aviation health systems that protect workers also protects the emotional balance of the wider population. You understand? So healthy systems create healthy people far beyond the airport fence. So what is the big picture? Aviation health is not about planes. It's about air quality, disease control, supply chain safety, environmental exposure, and community protection. It's about making sure that movement doesn't become harm. The reason most people don't notice aviation health is because when it works, nothing dramatic happens. No outbreak, no panic, no disruption, and that's exactly the goal. You understand? So, if this video changed the way you see aviation, even a little, then this channel is for you. Here on Health Aviation, I break down hidden health connections between aviation and everyday life using simple language and real world experience. If you want calm, trusted explanations about how health systems quietly protect you, subscribe to this channel, like this video so more people can understand the unseen systems keeping them safe. And in the next video, I'll explain one aviation health risk that most people experience weekly without realizing it. Stay informed, stay calm, and thank you for watching Health Aviation.